First, I would like to greet all of you on behalf of the People's Health Movement, which believes that health is a deeply social, cultural, and political issue. And the face of the crisis in the world today, including in Greece, including in many parts of Europe, and the crisis that our countries in Latin America, in Asia, and Africa have seen, the real face of that crisis is the crisis of health. On a more personal note, I'd also like to greet you on behalf of the working people of India. Alexander the Great was the first contact with Greece and India about 2,500 years back. But today we are not joined by kings and princes. We are joined by our common struggles. And I'm sure the working people of India are with the Greek people in their struggles, as we also believe that the working people of Greece are with the struggles of the Indian people. We live in a planet today which is, in a sense, a place for major contradictions. The world has never been as rich as it is today. The world has never known the kind of resources, the kind of technologies, the kind of tools that we have today to transform our lives. But the world has also never been so poor. We have never before in the history of this planet have had so many people dying, suffering, not because we do not know how to make a change, not because we cannot change those circumstances, but because the logic of capitalism is about keeping the largest number of people in conditions like they live today, and a small number of people taking advantage of the huge resources that we are able to accumulate on this planet. But the logic of capitalism is also its biggest weakness. Because in order for a few people to accumulate wealth as never before, the largest numbers of people have to be poor. Which means the few people who are rich today do not have the means to sell what they produce. And this has been reflected continuously in the cyclical crisis of capitalism. So, in a sense, the weakness of capitalism lies within the structure of capitalism itself. But capitalism is a strange beast. It has shown continuously the ability to come out of its cyclical crisis. But it has not been easy. The crisis of the 1930s ended with the Second World War. The crisis of the 1970s ended with virtual genocide of a whole continent. Of the whole continent of Africa, which slid back 20 years. We are here not talking about a few hundred deaths, a few thousand deaths. We are talking about millions of people who suffered in Africa, in Asia, in Latin America, suffered with their lives because capital needed to get out of its own crisis. Today, capital has turned against its own birthplace. Like the mythical beast which finally ends up by eating its own progeny, capital, to get out of its crisis, is turning to Europe. And the bigger the crisis, the larger the desperation today of capitalism to get out of the crisis at any cost. As someone had written 150 years ago, for a kind of profit which is large, there is no crime that capital is not capable of committing. And we see those crimes every day, in our lives, in our streets, in our villages, in our towns. We live those crimes of capital today as it tries desperately to come out of its crisis. In this last 1 week, we've received the hospitality of the Greek people. You have welcomed us into your homes, into your workplaces. You have shared your experiences, your struggles with us. And you, more than us, understand that Greece today is the face of the crisis in Europe. But more importantly for us, Greece today is also the face of the struggle in Europe. As I said at the beginning, the face of the crisis is also the health crisis. Because health, finally, is the mirror to what we do in society. So the first phase of the crisis is the collapse of employment, homelessness, collapse of families, which all determine whether people are going to live healthy lives. And we are seeing that today in Greece, as we have seen that for a very long time in many other parts of the world. And we see that as well in the crisis of the health system. We see repeated the same experiments which were conducted 30 years back in sub-Saharan Africa, in many parts of the developing world, of decimating health systems which were publicly run, of completely destroying public systems. It was one of the reasons for the genocide of millions of people in sub-Saharan Africa that I was talking about. And we see an attempt to replicate that in Europe today. We see an attempt to, in a planned manner, destroy 100 years of struggle in Europe to construct a health system that was comprehensive, that provided health services to everybody. I was talking before about the fact that today we have the tools to make our lives much better. But yet, in 1975, a child in Africa had about a 9 times less chance of survival till the age of 5 than a child in Europe. Today, a child in Africa has 27 times less chance of surviving till the age of 5 than a child in Europe. So that is what was created when capital, in order to get out of its crisis, transferred the effects of the crisis on the poor and the working people of the countries of the South. So we have today the neoliberal response to the health crisis. It is simple, and that's why it is effective. It is packaged in what is today called universal health coverage, which everybody, when they hear it for the first time, believe that it is something positive, that it is something actually which will change the situation of health services. The plan is very simple, and that's why it is effective. The plan is first to destroy public services, as you've seen it happen in Greece, as we have seen it happen in many parts of the world earlier. First, you destroy public services. You destroy public services first by what you call outsourcing to the private sector, not medical services to start with. So you outsource laundry services, you outsource ambulance services, you outsource dietary services. Many times, doctors and health professionals are silent as long as their services are maintained. And then you outsource medical services to the private sector, and you destroy public services. So that is the first step of the change that is to be brought about by universal health coverage. In Greece, we have learned in the last few days that, for example, in the last 3 years, there has been a 20 to 30% cut in the budget for public services in health. And then, when you have virtually converted a functioning public system into a system that doesn't work, you start talking about the health crisis. You say that there are no services and we must do something about it. But what are you going to do about it if there are no public services? Because you yourself, capital has killed off public services. So then you turn around and say, so we need the private sector to provide these services because they are the only ones left and they are, according to them, the only ones who are efficient. So you forget that while in the first place you were responsible for destroying public services, but you use that as an excuse now to handing over public services to the private sector. So in the name of universal health coverage then, you create a system of insurance which will be paid through public money, but where healthcare will now be provided by the private sector. So even the little public money that is now going to be put into health services will actually go to strengthen the private sector. So public money to strengthen the private sector. So on the other hand, capital also finds a new market, a market for health services where it did not exist earlier. This is the story that was played out in Latin America in the 1980s and 1990s. This is a story that has been played out in much of Asia and Africa. And this is the story that is now being played out in Europe in the name of universal health coverage. I want to end from where I started. That capitalism operates at the global level. It hunts. It's a hunter. It's a beast that hunts at the global level. So the opposition to this beast has also to come by joining our struggles at the global level. Because finally history shows us that they can take away our homes, they can take away our jobs, they can take away food from our plates, but we retain our memories and we retain our struggles. Your struggle is my struggle and my struggle is your struggle. Thank you.